Good afternoon. Coming to you from the Health and Wellness Center. It's August 27th, and here we are, still at it. I'm a little tired, so I apologize if that comes through. We'll talk about that a little bit, a little further in the presentation. You see up on your screen a slide that has a lot of words related to racism and discrimination, and I really feel compelled to bring this issue up again with the relentless and unmitigating issues and incidents that are occurring, the most recent one being the shooting of Jacob Blake, that we can't forget that we need to work on systemic racism in our culture, in our community, in our department. One of the things that I really feel compelled to say, and I don't know that all of you have understood this previously, so I want to make it really clear. Racism in any way, shape, or form is not tolerated in this department amongst our staff, with the people we serve, etc. That includes use of racial slurs, language that's demeaning to other people, microaggressions and such are things that we're learning about, and we're trying to educate all of you with our health equity and multicultural diversity training, which really is that foundation of work, but not the be-all, end-all. So there will always be work that needs to be done as we address systemic racism, but if there was any doubt in your mind, I want to make it clear that that's just not something that we can tolerate here, and we will continue to uphold and support that. All right. Our COVID update, we now have 24,242,000 cases of COVID across the world and 827,000 deaths. In the United States, we have 5.8 million cases of COVID and 180,000 deaths. When we get to California, we now have 679,000, almost 100 cases of COVID, and 12,407 fatalities. This is an increase of about 40,000 cases from last week and 884 deaths. And we're seeing a slight decrease in the positive rate across the state. In terms of Fresno County, our cases are now up to 23,932. This is just under 24,000 cases and 239 deaths. So we've added 34 deaths since last week. And remember, those death counts come in kind of in groups because of the way that deaths get reported through the coroner's office and such. In terms of hospitalization, we have today 230 individuals hospitalized in Fresno County, of which 53 are in the intensive care unit. This is a decline of 15 individuals in terms of hospitalization and 8 in terms of the ICU. Those are both excellent trends for us as we work toward getting a measure of control over the spread of COVID in order to be able to open up. If you'll recall, last week we talked about the measures that we weren't quite meeting. One of them is our positivity rate, which I'll talk about in a minute, and the other is we need to see a decline in hospitalizations and a decline in our death rate. And so both of those are issues we have to look at. When you look at the watch list, that's what this slide is for. It shows that we have had 48 new deaths in the last 14 days. That's unchanged from last week. And our test positivity is likely a slight increase. And so as we watch that test positivity and the number of cases, we are doing a little fewer tests, but continuing to see that positivity rate be up. And so we'll have to watch very closely our hospitalizations and deaths, which do follow those case rates. I did find this slide that I thought you might find interesting, and this is a little hard to see, but there's some lighter colored dotted lines that show you what the emergency department visits due to influenza-like illness, that's ILI on the slide, and that's year over year. So generally you see a similar representation. In the year 2017-18, there was a little spike at the end of the calendar year, the 2017 into 2018. And then you see what happened here this year. That is the dark green line, and really shows you that significant increase in influenza-like symptoms. And I thought that was interesting to look at, so I thought I would share it with you. I will talk a little bit as well. I've had some feedback with people telling me that it feels like we're being really secretive about outbreaks, both within the department as well as within the community. And there is probably a little bit of truth to that on one hand. On the one hand, the county, through our public health officer and public health department, has definitely taken the stance that COVID status is protected health information, and in some circumstances, if we reveal that there's been a COVID positive case or an outbreak in certain settings, it is believed that the general public might be able to determine who had COVID, and because that's protected health information, we have to be very careful with how we handle it. But I did want to talk about what happens when there is a positive case, and I'll speak specifically to what happens in the county. And so when someone, it's made known to us that someone in our department or someone in one of our contracted providers has a positive COVID case, whether that's an employee or somebody that we serve, there is a very formal process that happens in terms of contact tracing. And anyone who's been exposed to that person is notified of that exposure and told to quarantine themselves. And so that exposure is anyone who was within 6 feet or less for more than 15 minutes where one or both of you was unmasked, and particularly if both of you were not masked. And so we often do find that if everyone's following the guidelines, while you might work in an area where someone has acquired COVID, you would not have met that criteria for exposure. And so not everyone gets notified to the same level of detail simply because it all relates to that exposure level. We do want to make sure that people feel safe, and so I want to reassure you that when there's been identified positive COVID in any setting, we go through a very structured process. If we feel that there needs to be cleaning or any sort of fogging or things like that we do, and there's been very little, frankly, not very much COVID that we've had to deal with directly within the department, but we have had some. And when we do, we go through a very structured process working closely with public health. I understand that that probably won't satisfy each and every one of you who just wants to know, but again, there's this balance we have between protected health information and protecting all of you. And I do want to assure you that it is our utmost effort to protect all of you, and that's why we push so hard for you to do the things to protect yourself, because we want everyone to be safe. All right, so we will move on. We did the employee questionnaire around remote learning and the need for our staff to support children who might need support during the remote learning experience. And we had 403 respondents, which was about 74% of our staff did respond. About 40% of those reported having children who were 5 to 14 years old, where they were enrolled in remote learning and had an average start date of August 17th, which was last week, I believe, and required supervision between the hours of 8 a.m. and 5 p.m. About 70% of respondents said they were able to work their traditional schedule, and about 38% provided some narrative comments and concerns, which I'll highlight in a minute. So in detail, and I'm just going to go over a few of the questions in detail that I think might be of most interest to you. So one question was, as we strive to work with you during this critical time and meet the needs of the people we serve, we really wanted to know what hours and days are you available to work. So the vast majority, as I said, about 70% indicated 8 to 5. But we also had respondents, about 40% said it would be really helpful to them to have a 7 to 4 work schedule. A few said 9 to 6. Others wanted approved intermittent time off and using up to 40 hours of leave time or protected leave time. And then alternative work schedules were mentioned. Modified voluntary furlough, some would be interested in, a split shift, weekend shift. So we pretty much got all of those possible responses you could make people were interested in. So we are looking carefully at each of those, both in terms of broad departmental policy, but also individually working with each of you. So I said this last week and I'll say it again, please work with your supervisor if you have any needs. We will continue to work with you the best that we can to accommodate the need for you to support your student as well as do your job. All right, next one. Which of these best describes your feelings during COVID-19? A lot of you appreciate being able to telework. That's that large bar in the middle there. Some of you are bored. Many of you are exhausted. Some feel like you're stretched too thin. I do. Some are fearful. Some are happy to have more time with family. And so it was really good to see all of these responses and be able to consider where each of you are at. The next slide will tell you, and then on a scale of 1 to 5, how would you rate the amount of support you're receiving from the department while teleworking? A little under 50% of you rated it very highly, with 1 being lowest and 5 being highest. And then a little less at 4. A little less at 3, and a few of you are not too happy with the support that you've received. And so I did want to highlight some of the comments that people made as well. I miss working in the office, especially the equipment. However, for my own health reasons, I deeply appreciate that I'm able to do my job in a safe environment. Thank you to leadership for making health and safety a priority for employees in the community. The next comment, and this slide has all positive, don't worry, there's some negative ones too. Although current circumstances have really shifted what our normal is, and we do have to go on with some certain degree of uncertainty, I enjoyed the positive outcome of being able to telework and knowing that I can continue to be productive from home. And then this is a plug for myself. DeJuan's weekly updates have been a huge source of information regarding the current and ever-changing situation. My supervisor is reachable during office hours, and communication through Teams has been a huge benefit. And some of the other comments. Feeling anxious and concerned for the health and well-being of my staff when we are short-staffed and swamped with referrals. Automation connectivity has been an ongoing issue, but both DBH and IT staff have been helpful. At times, it's communicated that we are all in this together, but I question, are we really? Some supervisors do not consider that we have children and push us to breaking points. If we say we are drowning, then it is a question of whether we can handle it, and this is not easy, and we are doing the best we can. So I really want to acknowledge that I know that while some of you are enjoying teleworking and feeling like it's working really well, it is not always working well for all of you, and that came through loud and clear. I gave you this is a small, tiny fraction of the comments. I think I mentioned last week I have 16 pages of legal paper in small font of comments that I've been going through, and so I really do appreciate hearing how all of you are doing. This is a collective trauma that we're all going through in a fashion we've never had to deal with before. And we're being asked to do things that we never could have anticipated having to do, whether it's work from home while you're managing your children learning from home without the support of the school or daycare providers and such, whether it's worrying about your own health or the health of the people you care for. We're being asked to be frontline workers and continue to meet the needs of a vulnerable population, even when it feels like we're putting ourselves at risk. And that's really hard. So I do want to remind you again, I brought this up before, in terms of what you all can do to promote your health and well-being. I sent out to supervisors, just before I came down for this presentation, I sent out to supervisors some guidance on ways to best support themselves, their coworkers, and all of you. And, just encouraging all of you as well, take a day, take an hour, take 15 minutes to create space between your work and home life. Really try and limit the publicity and media coverage. I know for myself, I've said this before, I'll say it again, periodically I have to entirely get off social media in particular. It's just too much for me to deal with right now. Get mental health support. We're a mental health department, and behavioral health services, both substance use disorder as well as mental health. And there is no shame in any of you getting help as well. We have an employee assistance program called Dear Oak, and you can access that through our website, through the county's website. You get free of charge for you and your loved ones some support services. And so whether it's long-term therapy that would be most supportive to you or a very brief intervention, that is available, and I strongly encourage you, especially if you're feeling stressed and overwhelmed, to reach out and get that help. That may make a big difference for you, especially if you're finding it hard to find that break between your work and your home life. This is relentless. This is just relentless. It's not ending in any way, shape, or form anytime soon. And we're going to have to really find ways to build our resilience, which is hard. We all need to take time to show gratitude. It's really, really easy right now to focus on what's not working. I know I find myself falling into that trap, but we need to appreciate one another. Everyone's working hard. Everyone's overwhelmed. I don't know how we would get through it without all of you. I don't know where we would be without your dedication and your commitment. And I know I really can't say enough how much I appreciate all of you and how much I acknowledge how hard this is. It's hard for me too. And I can only imagine how hard it is when you're juggling other demands at home as well as work. And so we have to find a way to live with COVID. We have to find a way to protect ourselves and support each other. And we will continue to work toward strategies and helpful supports that we can, whether that's accommodating scheduling changes and such, or finding other resources that we can bring to bear to help support you as we go through this very prolonged pandemic. With that, I think I will go to questions. So this is a question. The CDC is directing that asymptomatic people don't need to get tested. How is this going to affect the county and the state? Newsflash, they've changed their mind again. I'm not really sure how it came about that the CDC said that asymptomatic people didn't need to get tested, but I think that is changing, and I'm not sure that even if it didn't change, that our county would change our strategy. And so stay tuned on that one. I know it's really frustrating when things change. Most of the time, guidance is changing as we learn more, but every once in a while it just changes in a way that's super frustrating and hard to understand. And so this is one that's a little hard to understand, and so stay tuned, it might change again. I have a friend that works for the court, and I'll just say this nicely, it makes me deeply appreciative of how we're handling this. Yeah, you know, it's been a struggle across our community. Sometimes we are in a new situation and we're making our way through as we learn how to handle it. And particularly with COVID, we have other partners that maybe haven't had the same supports as we've had with public health or the same guidance from their leadership. And so sometimes it feels a little disjointed how things are being handled or what guidance or advice is given. And so we're trying, as the county health departments and public health department, to really reach out and provide support when we find out that maybe it's a little less supportive. Is the county planning on implementing the president's payroll tax deferral? If so, will we be given the option to opt out? You know, I really don't know what's going on with that. I'm not sure that it's went through all of the processes it would need to go through for like the county as an employer to implement it, but as I learn more, I will certainly get back to you. There's a lot of moving parts right now, both in terms of our state legislature as well as the federal government. With the state legislature, I don't know if you've heard, but I believe it was in the Senate that someone tested positive, and it seems like it slightly disrupted the closing of the legislative session, which typically closes on the 31st. And so they kind of had to pivot and make some decisions about how they would complete the legislative session. By statute, it closes on August 31st. And so that's kind of upended a bit some of the potential bills and budget trailer language and such. And so we'll have to stay tuned on that. And then at the federal level, they've had some similar challenges with the legislation being closed, or the Senate and House sessions being closed, and whether or not they can bring people back to vote on certain things. So there's a lot we kind of have to just sit back and wait for, unfortunately, and that this is one of them. I do want to remind everyone that on September 1st, we begin Suicide Prevention Month. And I would encourage you all to go to our website, fresnocares.com. We have a lot of activities planned. Given the social distancing and such, some of them will be drive-through events, maybe look a little different than they have in years past. But we do hope that you'll all participate in that. I think I reported out in a prior update that we did have an uptick in suicides, completed suicides in June. That number came down in July, but it's something we're watching really closely, because just like all of us, this is a really challenging time. And it is not uncommon during periods of trauma like this, whether it's a pandemic or other disasters, that people can really struggle with their mental health. And so we're really watching that closely. We want to put as much of our effort as we can during Suicide Prevention Month and other times to get the word out there that it's good to talk about it. It's good to reduce the stigma and discrimination around mental health that sometimes stops people from seeking help at times when they might be having thoughts of suicide. And so we will continue with those efforts. We have some media campaigns and, as I said, a lot of other activities that we plan to do during the month of September to raise suicide prevention awareness. With that, I don't see any other questions, so thank you for those of you who are able to participate live, and for those of you watching via a recording, please know again that you're always welcome to send us questions or concerns, and if we don't answer them via the email, we'll bring them into the next update. Okay. It's fresnocares.org. Someone reminded me that I might have said fresnocares.com. Our suicide prevention website is fresnocares.org. I also had to check and see. A reminder, if you have a hard time asking a question via the YouTube chat, you can send an email to Christina Young, my assistant, who during these updates will forward those questions to us if she can, and then we can either answer them during the update if we get them in time, or we can answer them later. So again, thank you, and have a good rest of your week.